President Dr. Girish and our President Dr. Vimal Someshwar and our Vice President Dr. Arun Gupta. I am Dr. Ajit Yadav. I am asking question from them on behalf of our PG students in the radiology, why they want to go for the IR. So my first question is from Dr. Vimal. Sir, what is the scope of intervention radiology?
If you understand, interventional radiology is basically a good combination of imaging and imagination. And if this combination is there, you can do whole lot of procedures in interventional radiology. The branch involves using various catheters, wires, balloons, various devices. And all these devices can be introduced inside the body with a small little puncture or a pinhole surgery, as we call it. With that background, you can understand that as an interventional radiologist, you can enter any part of the body from a small little pinhole puncture. Now, if you have to give you an example, you can make a puncture in the artery in the groin, femoral artery, and you can reach all the way up to the brain or even a little toe in the leg. So the scope is huge. In fact, interventional radiology encompasses most of the body system and organ systems of the body. Right from brain, we do neuro interventions, we do body interventions in the chest, in the abdomen, we do peripheral arterial disease in the leg. Equally important is to understand various disease processes. We treat cancer, we treat blockages in the blood vessels related to atherosclerotic processes, we can treat bleeding cases which can be in the brain, it can be in the intestine, kidney, or in the females if they have excessive bleeding, per vaginal bleeding, we can treat that. So the scope is wide, huge. What is important is that people have now gone into sub-segmental specializations and they have become either neurointerventionist or a body interventionist or a peripheral vascular interventionist. So the scope is wide. As a junior, a student should pick up one particular specialization and develop and train himself in that particular area of interest.
Is it a branch of surgery or is it a branch of radiology?
It is a therapeutic branch of radiology. We know radiologists were diagnostics or are known as diagnostic, but interventional radiology are involved in therapy. They actually treat patients. We treat cancers, we treat wound ulcers, we treat bleeding patients. So you can see stones in the kidney are removed by interventional radiologists.